there are so many families dealing with children right now as we are worldwide in a quarantine. And I just came across a question from somebody who's struggling with one of their children, and I'd like to read this question to you. Being around my children over the past few weeks has provided me some interesting insight. I've recently noticed an increase in irritability within my 8-year-old. How do I know if this is a serious problem or I just need to be providing more activities? I mean, certainly, right, Dr. Bregman, a lot of kids bored, but then there are the kids that some problems are starting to surface. Parents are home, they're paying more attention. What would you say how a mother or father could identify a problem in their child, and how do you decipher between anxiety and depression?
Talking to our children about what's going on is often a difficult task. And lots of times children think about what we do as much as what we say. So we have to be, as parents, very cognizant about how we are. And if we're not feeling secure and be able to give a good message to the kids, then practice with some of your friends. When does this problem with children become something we should be more alarmed about? And it usually has to do with what's age appropriate for the child. So going through the spectrum from a child from like 2 to 5, they would become, much more regressed. They would become more clingy. They want to be a baby again. They want to sleep in your bed all the time. So any kind of signs of regression and decreased functioning, they're regressed in their self-care skills and, using the potty and so forth. Then the latency kids, maybe 8 to 10 years old and
right,
that age,
which would be this woman's child.
Okay, this woman's child. Okay, so because we're talking about an 8-year-old here. If we're talking about an 8-year-old in particular here, they're a little older developmentally. So some of their signs of regression are going to be different. But again, regression meaning they started with old habits again, things that they stopped doing. Their self-care skills are poor. Their hygiene becomes poor. They don't want to see their friends. They are very irritable. They don't sleep well. They don't really want to eat. So you could see there's a real change in functioning. And it lasts over a period of time, and reassurance doesn't work. So that's when we would think that we would want to maybe get some professional help.
Now, the mother asked the very pointed question. She's seeing some signs that are disturbing to her, but she wants to know, what is the difference between her child having anxiety, or is this a depression problem? How do you decipher between the two? Or is there a difference?
Well, look, a lot of kids are very resilient. They maybe have some bad moments like we all do, but they bounce back and they're able to play, they're able to talk to their friends, they're able to function with the family, and they're generally not doing too badly. Then there is a subset of kids, maybe this 8-year-old, that all of a sudden doesn't want to see his friends, doesn't sleep, doesn't want to do anything, is avoidant, appears depressed when you ask him, and actually crying a lot, for out of the blue, like, for no reason. Issues about negative mood, they're just, nothing makes them happy. They could even become avoidant, of the event. So that's when we want to think about getting some professional help.
Okay, so I think what I'm understanding from you is that anxiety and depression can overlap.
Let's talk about anxiety and depression. They're oftentimes mixed, and I think people want to separate them out. So when people are depressed, they could become agitated, have agitated depressions. They could have retarded depressions where they want to sleep all the time, or they can have associated anxiety, and they have anxiety with panic attacks and other facets of acute stress syndrome, acute anxiety syndrome.
So what can this mother, before she contacts someone like yourself in telemedicine, what could she do to maybe counteract the son or daughter being bored listless? What types of activities can she try before she realizes, you know what, this is beyond me, I need medical help?
So what is a parent to do with an 8-year-old? First, we need to, as a parent, set a good example for the parents, a good role model, that you're not freaking out all over the place. You're not catastrophizing events, that this is going to be the end of the world, this is a horrible thing. And, the child hears this and the child could feel abandoned, at this point. So you really want to be very proactive. You want to have a good relationship with your child. If you can't fake it even, you need to practice with your friends and show them a good role model, positive things. We're washing our hands, we're doing all the safe things, we're keeping our distance, and we're going to get through this. So what I'm saying here is that children are very dependent, and they depend on us, especially at 8, and they want to know you're going to be around and we're going to be around. So the abandonment issues, a lot of reassurance would help. Now, if it doesn't work and we really work and try hard, then it's best to seek some professional help.
I like that advice. Positivity and confidence goes a long way. Thank you, Dr. Bregman.
BregmanMD Medical Group offers online psychiatry and online therapy.